Hello and welcome to our webinar, Revitalizing Your Practice with Robotic Laser Therapy. My name is Lauren, and I am a member of the marketing team at Cutting Edge Laser Technologies, the sponsor of today's presentation. I am pleased to introduce Dr. Tim Brennan, owner of Brennan Chiropractic and Laser Pain Solutions in Annville, Pennsylvania. With 30 years of experience, Dr. Brennan is committed to offering his patients the latest treatment options, including robotic MLS laser therapy. Joining him today is his son Patrick, a graduate of Westchester University, a certified MLS laser therapy technician, and the marketing coordinator at their practice. During this presentation, they will provide insight into how you can successfully incorporate laser therapy services into your practice. And now I'd like to welcome Dr. Tim Brennan.
Good afternoon. Lauren's introduction out of the way here, we'll jump right into the subject matter here. As a general overview of my practice for the chiropractors that are tuning into this, I've been in practice for over 30 years, and my practice is a very well-rounded musculoskeletal chiropractic practice of all ages, from children to seniors. Adjusting-wise, I use a variety of techniques from the Palmer package, as well as soft tissue work and instrumentation. I use the Sigma Ultraline instrument. Therapies in the practice over the years, we've used muscle stimulation, ultrasound, decompressive traction, and obviously within the last 4 years have been emphasizing the MLS robotic laser. My philosophy has always been one of wanting to have and lead by using technology within the practice and using the best available therapies in order to get the best outcomes for my patients. So the MLS laser has been of tremendous value to us in our practice. So as an agenda here, just going over what we're going to discuss, certainly the importance of cash-based services into your practice, strengthening the cash flow using MLS laser therapy. We're going to talk a little bit about integrating the laser therapy services into your practice and what we have done that has been successful. We're going to talk about managing patient expectations for laser therapy. It's crucial to have the expectations of the patients established up front. And then Patrick is going to give you some good information about marketing. Marketing this laser is a crucial piece of success for your practice. So we started with why add a cash-based service to your practice. Well, it's kind of a no-brainer to add any and all worthwhile cash-based services to your practice. It's kind of common sense. Anything that is going to benefit the patients and improve your outcomes that can also be cash-based is obviously a good practice. It's a very dangerous thing to have all your eggs in one basket. I practiced in Oregon in 1989 and 90 when the legislature took work comp away from chiropractic. The practice I was in was about 80% work comp and PI, and within 1 week, the practice was decimated. And that's how I made my way back to Pennsylvania from Oregon based on that very challenging time in Oregon. So having a diversity of your practice is crucial. It's very important to begin to reduce your reliance upon insurance reimbursements. In Pennsylvania right now, to do muscle stim or ultrasound, we may charge $20 or $25, but we get reimbursed $10 or $12 per service. So it is a loss almost operating at that cost. Giving you the opportunities to specialize your practice. So many of my fellow chiropractors have specializations in nutrition or sports injuries or pediatrics per se. We have taken the opportunity to use the MLS robotic laser as an extremely effective tool to set our practice apart from our competitors. It allows us to offer, again, cutting-edge therapy that is extremely effective and has made a significant difference again in our outcomes for our practice. Differentiating the patient types that you get. So as a 30-year practitioner, I've treated all kinds of conditions and extremity conditions. But this MLS laser has opened the door to conditions that I never would have seen before. And of course, you need to follow your state's guidelines and regulations and practice acts and your scope of practices. But it, in general, allows you to treat conditions, inflammatory conditions, in a variety of extremities that are not typically things that come walking in your door. And we've had great success helping those patients. In general, in our practice, as an overview, we've done over $200,000 in cash-based laser services over the past 3 years. So the potential is significant if you do it correctly. So leveraging the market trends, right? This is what it's all about. Pain management is a growing modality. 1 in 5 Americans suffer from chronic pain, according to the CDC. Chiropractors know this very well. Obviously, Americans spend more on neck and lower back pain than any other health condition. But they're also, beyond that, they're looking for safe, non-invasive, non-addictive means to receive and get relief from these conditions. So they're concerned about potential harmful side effects of the opioids, obviously. They want to avoid downtime after surgery. Patients generally are unsatisfied with care received from traditional medical avenues. Most of our patients that we're getting in for this laser are people that have been through the medical mill, and they are looking for an alternative that is, again, safe and non-addictive and effective. And we have the ability to offer that with the MLS laser. I think it's important for us we're going to look at how we've used the MLS laser to capitalize on these trends. But I think first it's important for us to go over just some general information about the unique laser therapy that we have available to us in this MLS robot. So this is one of our slides from the class that we do. And basically you're answering 2 questions, what it is and what it's not, right? So MLS stands for multi-wave lock system. It's the description of the patented system that was designed within this laser. It uses specific wavelengths of infrared light to relieve pain, reduce inflammation, and most importantly, promote wound healing and soft tissue repair. It reduces the needs for medications. We have many patients that are able to stop taking medications that can be very harmful to them and can certainly delay potential surgery. There's no negative side effects. Say that again, there's no negative side effects to this laser. It was the reason I purchased this specific laser, because of the safety that is built into the design of the laser. There's no risks, therefore, for patients. There's very few contraindications to offering this therapy. And it's been proven to be effective in over 90% of it. What it's not a cure-all. This isn't magic. It's based on biology and the body's reaction to this infrared light as it interacts with the body. It is not an invasive procedure in any way, shape, or form. It's very safe. It is not laser surgery. We're not operating or cutting any kind of areas of the body with this laser. It's neither hot nor cold. So the terms out there now, when we have people that come in and ask us about this, is it cold or hot laser? MLS is really in a category of its own within the class 4 lasers because of the control mechanism built within the safety control mechanisms built within the unit that protect the patients while providing the dosage that we're providing. And it's not a replacement for common sense. This is important for people to understand. If you keep doing the same thing in the same way day in and day out, you're not going to get different results. So that's a little bit about what it is and what it's not. So it's a unique type of class 4 therapy laser. As I said, it's synchronized dual wavelengths. You have a continuous 808 and a pulsed 905 wavelength. These do different things, but the beauty of this laser is that no matter what setting or technique you're utilizing, you're getting a constant, the patient's getting a constant interaction of both the continuous wavelength and the pulse wavelength. The continuous wavelength provides a reduction in the inflammation and the edema. That's where we see the swelling reduced very, very quickly with this laser. And the pulse 905 creates the analgesia. So analgesia reduces the pain that patients may be experiencing. It's the coupling of these two wavelengths in such a safe way that allows us to get the results that we get. So this is the beauty of this. It's robotic and unattended. I had the first version of the Mix 5 in the state of Pennsylvania. It was a good instrument and I was able to help people, but it was very frustrating because every 2 minutes in an 8-minute treatment, I had to come and move the laser. It would shut off. I had to reposition it. I had to restart it. It was very time consuming. The other factors that play in there is that you end up moving the head. You're losing your focal point. The effectiveness of the treatment was less than optimal. The robot and the ability to position it and create your target zone is very effective at improving the dosage and the outcomes you get. You get multi-targeting functionality, evenly scans wide treatment areas. It calculates the necessary energy emission based on the set parameters. The controlled temperature stays below threshold for thermal damage. This is, again, a crucial part of this. We can go through post-surgical areas, screws, plates, without creating a thermal effect that would be damaging or problematic to the patients. It increases your productivity. I am blessed to have my son with me as my certified laser technician. I do the diagnosing, I set up the treatment protocols, and he applies the therapies. So he is with the patient through the process, and he can take care of 2 or 3 people at a time. As a single provider, though, as a practitioner, a solo practitioner, this robot is an excellent tool to be able to set up your protocol, be able to leave the room, go take care of somebody else, and then come back and know that the treatment dosage was done very specifically and accurately. So it facilitates a much more effective treatment. And then within this COVID environment, the ability to have social distancing and to protect patients and yourselves with the ability to not have contact and to be able to stay a specific distance certainly is an advantage that you don't find with handheld lasers. There's a tremendous upside to the robotic aspects of this laser. So how does it work? This is a mouthful, but photobiomodulation is the term we utilize. It's essentially the conversion of infrared light into biochemical energy, which has a cascading effect. Specifically, you get the release of vasodilating chemicals, nitrous oxide. The improved microcirculation increases the supply of cellular nutrition. You have an increased transport of nutrients into and out of the cell membrane and organelles, thereby increasing the production of ATP due to the stimulation of the mitochondria. The end result is you have an escalated production of the cell building blocks, the RNA and DNA. So this is so much more than just sticking a needle into a joint and squirting some cortisone into it and getting an anti-inflammatory effect. This creates a reparative process, which is really why the laser is as effective as it is. The end result is this process results in normal cell functions being restored and an accelerated healing process. So what we tell our patients, these are the basic results of photobiomodulation. You have anti-inflammatory and anti-edema effect. This basically is due to the vasodilation and the lymphatic drainage. This is the first thing you see with patients. The swelling and edema reduces very quickly. It's a very important part for patients to see the effects that they're getting right up front. You get an analgesic effect, blocks the pain in the nerve cells, it releases localized endorphins, and more importantly, again, it's repairing damaged nerves, not just blocking the pain like a TENS unit. There's a reparative process. You end up with optimal tissue repair. So our bodies know how to repair themselves, but the concentrated light results in an accelerated and more efficient healing process. You end up with improved circulation and nerve function. This is a critical one. One of the primary questions that we get from patients all the time is, how long does this last? In my opinion, it's this restoration and formation of new capillaries, of new blood flow, fresh blood flow into well underserved areas which is responsible for the long-term positive effects that patients get long after the therapy is done. The other benefits, so it's effective in both acute and chronic conditions. In my 30 years, I've not had a therapy that is as effective as this laser is with reducing acute injuries quickly. Patients are extremely satisfied with the results when they are acute. The chronic conditions respond well as well. They respond, just takes longer basically to get them where you need to be. They have to understand that the condition's been there longer. It takes an accumulation of the therapeutic effect of the laser to get the changes, but we see those changes all the time. It minimizes the needs for medications. Again, no negative side effects to this, and it decreases the time it takes to resume normal activities. And ultimately, that's what we're after, is getting our patients the ability to return to the functions and the things that they want to do with less pain. How has this been determined? Well, there's over 100 phase 3 randomized, double-blind, placebo-controlled clinical trials since it was discovered in 1967. So that research can be found on the Cutting Edge website if it's something you're interested in. So we're going to talk a little bit about cost structure and pricing. I want to outline this first by saying that we received training after we purchased our first laser through Cutting Edge. That training was critical for establishing a business model. You cannot just buy this laser and put it in your office and expect it to work. It will therapeutically work, but in order to grow the practice, you have to have a business structure. You have to have a guide to follow, and we received excellent training, which gave us the groundwork to build and to kind of create our own business model. So we didn't invent the wheel here. We took what we were given and we transformed it based on our market and our practice. So it's a critical part of the process. If you get a chance to have training, please take advantage of that. You know, the cost structure comes down to one thing: it's your zip code, essentially. You know what your region can tolerate. I called around to different practices in different parts of the country. I found prices varying anywhere from $50 to $100 per service. I took into consideration the region in which we live in, and then we established our prices. You as the doctor and the staff need to be very comfortable with what you decide to charge. It is a crucial part of confidently dispensing to patients the value of this specific therapy that you're providing. The structure can be varied. We were given a model that we utilized to start with that was effective. It was something whereby you might have a round one, which was the initial phase of treatment, which was a certain price. And then if there was more treatment needed in round two, you would discount, and then there might be a maintenance price for people that wanted to utilize this as a maintenance therapy. As we evolved and through the process of COVID, we're now at we have a single price for both one area or if it's a double area. So for instance, someone that has a bilateral knee condition, the pricing that we set is it's the same price for both treatments. It goes from 20 minutes to 40 minutes, so it's twice the treatment time. But you can vary that. There are ways to do that pretty creatively. There is no one right way of doing this. We have found that having a single price and carrying that through is the most effective way for us to do it. But you need to know your cost per service. So it's important that you are charging enough to have this be a profitable part of your practice. So it's important to really understand the costs that are involved in providing the service and making sure that you have it priced very competitively. Payment options are fine. You need to be flexible, but we have found that it is most effective to sell this in packages of at least 6 or 12. We do not recommend doing this on a pay-as-you-go type of process. People could do 2 or 3 lasers and not see the effectiveness and decide to quit. So it's important that you sell a minimum of 6. We believe 2 weeks of this therapy is enough to demonstrate its effectiveness and then carry on from there. We find it's best to have patients pay up front for the services. We do that most often, but we do have options for paying one half and one half. So your office can determine, knowing your area that you practice in, what's best. But you've got to be comfortable talking about finances and money. You have to be structured in how you're presenting that to patients. And it's important that everybody in the office is comfortable dealing with those things. So in our office, we have typical treatment packages, as I mentioned before. It's important to note that all treatments are based upon a thorough consult and examination and any special studies that you may need. It's critical to know what you're treating specifically so that you can set the appropriate techniques up to get the best outcomes. So we have a process whereby patients, new patients to us, will go through a consult. They will be examined, and then again, if x-rays are needed or they bring in MRIs or x-rays, we want to make sure we study them. In the office as well, some of our patients go through a 2-day process whereby we collect this information on the first day, and then the second day they would return for what we call report of findings. In that report, it's my job to answer 4 questions. Number 1, what's wrong? Number 2, is it a condition the laser can treat and help and be effective with? Number 3, how long is it going to take? What's the schedule going to be? And number 4, how much will that cost? That process is typically a 2-day process, but there are cases that can be done in a single day. It depends upon your practice, but it's very important up front to understand what you're treating so you can set the appropriate plan up. Patient scheduling obviously depends upon the condition. Most of our conditions, there are either 2 types, there's chronic or acute. The acute conditions are typically treated on what we call a round 1 of 6. And the chronic conditions, things that are present for longer than a couple of months, are treated with what we call a round 1 of 12. Typical plans consist of 2 or 3 visits per week for 2 to 6 weeks. Here's the most important part that we find. This laser is tremendous and in and of itself is effective, but it's really critical that you couple it with any services that you provide in your office that you believe will increase your results. If it's a spinal case, obviously adjustments or spinal manipulations. If it's a disc condition, we use decompressive therapy, traction therapy in our office. Exercise is crucial to get patients, once they're out of pain and moving, into exercise programs, more active plans. This is one of the really positive upsides of this laser is you take a person that's had chronic immobility and inflammation and you reduce it and they're able to start exercising again where they couldn't before. We use soft tissue mobilization in order to couple with the much of the extremity work that we do. And there are supplements, obviously, that can help people cope with and deal with inflammation that helps the process. So it's important to get it right up front and to make sure you present this to patients so they understand exactly what they're looking at with regard to the treatment that you're proposing. And in this report of findings, in this time up front, it's critical to establish some outcome expectations. So what do I mean by that? If I have a patient that has bilateral bone-on-bone knee with a VAS score of 8, it would be silly for me to sit there and tell that patient after 12 visits they're not going to have any pain. I often utilize a 50% goal for my chronic patients. So that patient with a VAS score of 8, my goal after 4 weeks and 12 treatments would be a 50% reduction in that pain. People are thrilled to hear that their pain is going to go from an 8 to a 4. So it sets a reasonable expectation. And then it also gives you room to then continue with treatments based on the progress that they've made. In acute cases, I'm often able to tell people I'm 80, and in 6 visits, they're going to be 80 or 90% better. So it depends on the case, but it's important in your report of findings that you establish that up front. It's really important to have re-examination processes. In our office, we don't charge for the laser re-exams. It's a part of the package up front. But when they're done with their package, you sit down with them and you review their progress. And it enables you, again, to have a mini report of findings and perhaps establish a second round of treatment if further progress is desired. Educating up front, establishing value. That's a part of why we are successful. We have pre-COVID, we had classes. We would have a couple classes a month where the public was invited to learn about laser therapy. We have now a video that we have put together that we show our new patients that are prospective laser cases during their visit to the office so that they're able to understand what they're getting and why it works and how it works and the costs. So education is critical. You want to have materials ready, and you certainly want to have a website that you can refer people to. And Patrick's going to talk a little bit more about this in the marketing aspect of the program here. So ideal patients. There's a term out there called low-hanging fruit. There is so much low-hanging fruit out there that is just prime for this laser. Acute injuries. Again, I've never seen a tool that's as effective at reducing inflammation and pain as this laser. There are so many patients that are trying to avoid surgeries for knee replacements, shoulder surgeries, ankle, feet. There's so many conditions that are treatable with this laser that you want to target those cases that are going to get you the best outcomes first. Don't start with, if you can avoid it, the failed back surgeries or the bilateral diabetic neuropathies. There are much better cases to start with, right? It's important to pick those cases so that you can have confidence utilizing this laser, and you'll get more referrals from those patients that you're helping. They'll be feeding into the practice. You got to remember, you're having patients coming to you for the most part that have been through the medical mill. They are looking for hope. And so you're providing and offering a safe, non-addictive, very effective treatment for the types of conditions that they're presenting with. You have to be able to handle the insurance questions and be able to clearly understand why the insurance companies are not paying for this. It is a cash-based service. And so you need to be prepared and well-versed on how you're going to answer that. It's a very straightforward question. It's simply not covered by the insurance companies, and it's a cash-based service. They consider it experimental at this point in time. So we don't have any problems with it. You just have to have everybody in your office prepped to be able to handle that question. It's probably the number one question besides how long does the laser last. You want to promote common sense. People can't continue to do the same thing in the same way and incorrectly and expect different results. You need to work on behavioral modification with these patients. And really importantly, you need to be able to let people go. This isn't for everybody. You don't want to have people that are not going to be consistent and are not going to respect your treatment recommendations. So sometimes the best thing is just to say that this is just maybe not for you as a patient. So those are the basic overview on how we in our practice manage this. What we're going to talk about now for a few minutes is the marketing of this. I will say that it's critical, and Patrick will review these points, to have a very well-established marketing plan. People do not know that this laser exists and how it works. So I'm going to let Patrick talk about the marketing here.
Hey everybody, this is Patrick. I've been marketing the laser for 4 years, almost 5 years. This summer will be 5 years. And you can do as much as you want with the laser. You always are trying to keep the bucket full because that's been the major challenge with marketing the laser is it's so effective. People get better and then very quickly, and then you don't see them again, usually until they get another injury and they want your services. So you're always trying to strive to keep that bucket full, keep people coming in the door, acquiring new leads. So I'm not going to make this too complicated. I'm not going to talk about specific budgets because the cost of advertising varies everywhere. I am going to discuss just some basics and what worked for us when we were first starting this project and how we grew the laser business. The general agenda is going to be why you need to market, how to get started, some goals to work towards, and attracting patients from outside of your office. Why the need to market the laser? As Dr. Brennan just said, there is a general lack of public awareness. even though this has been around for years, most of the public, 90% of the public has no idea infrared and laser therapy exists. It's probably due to a lack of insurance coverage, a lack of recommendation from family doctors. Physical therapy doesn't utilize lasers. People just don't know this is an option. Number two, you need to inform potential clients about the value propositions for this. Why would people use this instead of their insurance? Why should they circumvent the normal system to come see you? Some basic propositions is it's very unique. It helps you avoid shots, injections, surgeries. It can help you get off your medications. Those are all major selling points to people. It's very safe compared to traditional medical treatments because there's no side effects. Usually everything that's done in medicine, besides physical therapy, is going to have some sort of side effect. So that's a big selling point. It's not invasive. We're not cutting or burning. I can't hurt anyone with this laser. And another one that is very crucial is there is an actual healing response that's going to occur. We're not just masking pain. Like, you're actually going to get better. You're not going to have to continuously do this the rest of your life. So that's really important to establish with people in your marketing. Another reason to do marketing is it sets you apart from other providers in your area. People need to know that you have this exclusive option to treat your pain that no one else has, and it's very effective. You need to let people know that you got this to get better patient outcomes. Like, it's all about your patients. It's all about enhancing their experience and getting better patient outcomes. And then the last reason here is you need to start letting people know that you're treating a wider variety of injuries. A lot of people think about chiropractors and think they just treat low back and neck pain. That's not going to be the case anymore once you get this laser. You're going to want to treat all different types of joint injuries. You want to try and get as many different types of injuries as you can into your office. So how to get started with marketing? Before your start date, about a month and a half or two, when you start doing these therapies, you want to make some public announcements, and you want to continuously announce this to the community. You can do this through social media, radio, newspaper. You can send email blasts out. You can mail flyers to different communities in your area. You want to get the word out repetitively and in as many ways as you can so you can reach as many people as you can. About 1.5 months prior to the start date in your office, start posting to social media 1 time a week. You want to hammer home those value propositions that we just talked about as your main content, and marketing that you can, this is an effective treatment for knee arthritis or sports injuries. You want to start getting the word out there to people, little tidbits, and you want to increase the frequency of these tidbits the closer you get to the start date. So, like I said, maybe you start out once a week, you go to twice a week with posts on Facebook, continue to do more and more. And definitely, the week before you start, you want to have your heaviest rotation of advertising. You want to start talking to patients about it and create a buzz in your office around the laser. Get your patients excited that you're doing this, that they're going to have this option if they need it. You want to get them to start talking to their friends and family members who they know that would benefit from this treatment. You want to put some signage around your office, get brochures and handouts to get to people. You can use this information in a referral packet. You can just hand people an envelope with this information. It'll be an easy way for them to get to spread the word to someone else. Really nice packaged information. Something that we did in office is we got all the addresses for our current patients and anyone that had been to the office within the past 10 years. We sent out a letter to everyone explaining the treatment, letting them know what it treats, how it works, and we offered them a free laser exam. if they wanted to come in. They just had to reference the letter. Another really important thing to do is create a dedicated page on your website about laser therapy. You want to have your information on there, so anyone that sees you on social media or hears you on the radio, if they don't call you, then they can go to your website and get the information and get more detailed information. Usually on the phone, you don't want to get into the too nitty-gritty details. People can read that online if they want all of the information. And additionally, you want to build a PowerPoint presentation so you can educate people in public. This is one of the easiest and most effective ways to get new patients in your office. You can sign people up at the events, for an exam, offer them some sort of discount for coming. But, the PowerPoint presentation is something you're going to want to have. It'll make your life a lot easier. Before you run ads, Dr. Brennan talked about this before, you have to be prepared to talk about the laser and answer any question. People will call and ask all kinds of stuff about price, treatment plans, effectiveness. Is this covered by insurance? How long is this going to last? Does this help this pain? Does this help that pain? I've had this for years. Is this still going to work? So you got to be ready to answer these types of questions. Your staff should also be very positive about it on the phone. Something that we did for our staff to help them is we wrote a script out for them, and we kind of hung it in front of the phones. And it was a script that described what the treatment is and explained the primary benefits, and also told the patients those value propositions. You want to have a plan. I talked about the plan for your announcement. You want to keep your marketing consistent, and you want to keep your budget strict. So you want to have your marketing planned out about 1 or 2 months ahead of time. If you're doing classes, the timing of your advertisements is very important, and you don't want to be rushed when you're doing these things. Something that I did to start is when we would have a class, I would plan the marketing out. I would plan the dates of the classes out ahead of time, and then I would plan the dates of when I needed to submit articles. So they ran 2 weeks prior to the class, so people had time to call. Again, you want to plan this out ahead of time so you can have your content planned and you're not rushed. Your social media content, I try to plan out 2 weeks ahead of time, so I'm not rushed, and I can do this on a weekend, and that way I don't have to think about it during my work day. You really need to have time to think of good content, so you're not just posting bland things or reiterating yourself all the time. And planning will also help you to keep control of your budget, and you can track your return on your investment better. We're going to talk about some goals here. You want to work towards having a brand, building your brand, becoming recognizable just based on your colors and your logo and your tagline. Some examples of some taglines are, beat the pain, get better faster, live life on your terms, don't let pain hold you back, etc. Over time, branding will help the public better identify you. You will become synonymous with your colors and your taglines, because when people see your ads, they're not necessarily going to need you at that moment. So when they do have an injury and something does happen, they will more readily be able to remember you, and if you have consistent branding and advertising slogans. Another thing I usually tell people about marketing is a consumer has to see you 5 times before they remember you. So you want to, again, have your ads at a consistent frequency, consistent branding, to promote people to remember you when it comes time for them to need your services. A very important tool when you're first starting out are testimonials, whether they're video or they're written, because number one, patient testimonials are free. They don't cost you anything, and you can use them ubiquitously throughout your marketing plan. You can put them on your website. You can put written testimonials on your blog. You can put video testimonials on YouTube. Anyone that calls the office and
They're not necessarily sold on the laser. They don't know if they want to come in for an exam. Let's say they have knee pain. You can just send them to this video on your website of a patient talking about how much the laser helped their life get better because they have less knee pain. They're just invaluable. Again, the video would be preferred because it can help a patient visualize what the treatment looks like. It can show people that it doesn't hurt to get the service. It's easy to do. The patient's comfortable. Some recommendations for written testimonials. People sometimes don't trust them because they've just been used over and over again, especially in TV. Like, people just sometimes don't trust written testimonials. So what we try to do is we try to tell someone's story. You want to talk about what their life was like before laser therapy, how their experience was in their office, how easy it was to do the treatments, and what types of positive changes have happened, since they've gotten the treatment. That will really hammer home to people why they should get the therapy. Like, you won't even have to focus on those value propositions. If you get a great testimonial from someone, people will be calling you left and right. You want to use a combination of print and digital marketing, maybe a little bit of radio as well, but you want to reach the most people that you can. So you need to combine print and digital, because not everybody reads the newspaper or the local magazines, and not everyone is on the internet looking at ads. A lot of people, a lot of the older patients with arthritis, they're still reading papers. Unfortunately, you don't have a crystal ball to tell you what's going to work and what's not going to work. So it's important to, like I said before, have a plan and stick to your plan, and make some changes after a few months. But you have to be patient in order to find out what's going to work and what's not going to work. If you really aren't having success getting leads, don't be afraid to consult with a professional. Any news agency in your area will be able to send a sales representative to you to talk to you about what to do, how they can help, and you can usually control your budget. Last but not least, here we're going to talk about attracting new patients to your office. These are people that aren't referrals, and these are people that aren't currently patients. We did this by heavily marketing public teachings. I know this is a little bit more complicated nowadays, but there's a lot of availability to do this through Zoom. There's also Facebook Live. There's different ways to market those things, but I'm just, in general, you want to funnel everyone calling the office about the laser to your classes. It's the best way to build rapport with these people. That way they're not on the phone with your staff asking them all kinds of questions. They can just come to the class and ask you. So that's really important. People that come to the class, like, they get to see you, they get to know you, and you can build rapport with them and build trust, so that if they do want to come in for a laser exam, it'll be a really easy sell. Again, funneling everyone that's calling to these classes, unless someone calls and you tell them the cost, you tell them that it's not covered by insurance, and they know they want to start, then just have them in for an exam. But everyone else, you want them coming in and talking to you in a group setting. Your target clients for this, it's chronic pain, especially arthritis, knee, ankle, shoulder arthritis, people with chronic low back pain or neck pain. Maybe they've lost their range of motion and they haven't been able to move right for years. And Dr. Brennan talked about this a lot. A lot of the patients we saw initially were people who were failed by the traditional medical system, people that have been through the ringer. They've been to PT, they've got shots, they're on pills, they've been to multiple doctors, and they're not satisfied, nothing's helping them. Those people are people who will be willing to try the laser, because it's totally different. Make sure you have a great website page with some videos on there, some pictures of the laser. If in case they can't make the class, at least they can go get some information online and think about it and then make a decision. So on the next few slides, I'm going to go over some images that I have there of just a variety of different types of ads and where we use them. So this picture right here is a picture of a coupon that we would give out at our laser classes. Something that we did in our marketing, and you'll see this in a future slides. So we would advertise a treatment discount for coming to the class, and that was a big deal for people. Believe it or not, $50 really matters to clients. So $50 would essentially cover the cost of a single treatment, or it would cover the cost of their laser exam. It was a definite draw, and it was nice to just hand people a coupon. It's really easy. We just made this in a Word document, print them out, and cut them out. I talked a lot about branding. I have 4 examples of our logo. We have 2 on the left-hand side that have different formats, and I have 2 on the right-hand side that, when I'm trying to create content on Facebook or other ways that I advertise, like if I want to advertise a specific body part, I have our logo next to, someone holding their low back. They have low back pain. Or if I'm advertising plantar fasciitis for that week, I'll post a picture with our logo and, this foot picture. It's just, again, focusing on creating content, creating better content over time. This picture on the left is a poster from Cutting Edge. This is one of my favorite things. I think this is a really attractive poster. It's very eye-catching. I use this on Facebook. You could print this out and hang it up in your office. You could put this in your referral packet. It's an excellent piece of information. The bottom right is a screenshot from a commercial. We've done 3 different versions of commercials, and the one week I was trying to figure out how to create some content to advertise foot and heel pain, and I took a screenshot of this and I posted it as a picture on Facebook and wrote a caption for it. And then the top right, that was actually a newspaper ad. You can see our tagline there: beat the pain, the value proposition without shots, surgery, or medications. We have our website on there. Schedule your free laser exam, $50 value. It shows the types of injuries that are treated, and it has our logo. These are all very important things. Also, this ad shows a middle-aged woman with shoulder pain. Middle-aged women are probably 60% of my patients. So we do a lot of ads targeting those people. I did a whole campaign around that woman, and on the top, the man holding his back, looks like he was moving something. Those were digital ads. Again, the value proposition, the tagline, what does it do? Your logo. The bottom middle, we put this in a gym. This ad was clearly targeting athletes. On the right-hand side was one of those advertorials or testimonials I was talking about, where we wrote someone's story and we ran this in a local newspaper advertising our classes. It's a knee article. I said knee arthritis is a very common treatment that we do. It says treatment discount for class attendees, has our logo. We used somebody to do our interviews for us. Her name was Joan Carey, and she helped us design a lot of our ads. She was very important to us first starting out. So if you're having problems getting started with your marketing or figuring out the right things to do and say, this woman, Joan Carey, I believe she is a part of, or she's contracted by Cutting Edge. She is the person to go to, and your sales representative should be able to refer you to her. These are some digital ads. These are ads that were on Facebook. These were made by another media company. Discover the path to less pain without drugs or surgery. So that's like a tagline, value proposition. And the grab here is schedule a free consultation. I did have some commercials here that I wanted to show you guys too. Like I said before, we've done 3 different versions of commercials. This is by far the best one we've done. These are each 30 seconds. I'm going to show each of them to you. You can see how each one was marketed to a different audience. The one was to an older audience. The one was to a younger audience. These don't necessarily hammer home the value propositions, but it leads people to a conclusion that laser therapy is the best way for them to get better.
I've worked really hard to accomplish my fitness goals, The last time I twisted my ankle, it took me weeks to get back to normal and get back into my routine, and I lost so much of my progress.
Brennan Chiropractic has a solution to help you rapidly recover from an injury through MLS laser therapy.
The faster the treatment, the faster I can get back to my full strength.
We can start treatment the same day you call. Continue to pursue what you love to do. Don't let an injury slow you down. Call or click today to schedule a free laser consultation.
So that was obviously focused towards a younger audience, and we have the free laser consultation at the end.
I want to be able to play with my grandkids on the weekends, but I don't think this medication is going to help me do what I want to do.
Don't settle for the endless path of prescriptions and injections.
I want a chance to actually get better, not mask my symptoms.
Brennan Chiropractic is a safe alternative to relieve pain through MLS laser therapy. Don't miss out on what you love to do. Call or click today to schedule a free laser consultation.
Dr. Brennan and I have been doing this for several years. These commercials were very expensive, but we've built our practice up to the point where we had the budget to do something like that. I personally am just always trying to do things better. And if you're having success with your practice and you have room to grow, definitely start to investigate some more expensive marketing tools. You want to get in front of as many people as you can. Not something you need to worry about right away, but always good to have goals in mind, and you're always trying to improve your content. And that's what I have to say about marketing.
Thanks, Doc. Finally, one last piece before we wrap up here is just talking about staffing. It is critical that you and your staff are on the same page and that you're well versed with discussing the laser in a variety of settings. Phone conversations, front desk conversations, during office visits. So having materials ready is very important. As Patrick said, we script the staff on how to answer some basic questions. It's an important part of the success. You want to have your paperwork in order and planned and organized such that your treatment plans and the phase of care that the patient might be in are easily accessed and can be discussed with the patients very clearly. So you got to spend some time training your staff, especially the front desk and the people that are going to be on the phones answering the questions. I certainly see this laser as an effective tool in a solo practitioner's office. Again, the robotic features enable and allow a solo practitioner to be able to manage this very easily. But if you're able to hire and have a laser technician available, it will certainly make it more efficient for you. How many lasers your practice may have? Like, we started with one. As soon as I had one, I knew I would need two. When I had two, I knew I would need four. So we have 4 lasers. We utilize 2 every day. We have a third that we move in and out as a way to decrease the wear and tear on the other lasers. We will be expanding our practice and shortly anticipate, hopefully in 2021, to be using all 4 lasers at one time. So this is what you need to ask yourself. These are your final considerations for this. How can a cash-based service strengthen the bottom line of my chiropractic business? We have clearly shown in the last 4 years that you can exponentially improve the cash-based services. How could laser therapy fit into your current business model? Chiropractically, again, this is just a no-brainer. You have people in pain, you have people with inflammation. There's no better tool on the market to improve outcomes than this MLS robotic laser. How can laser therapy elevate patient care at my practice? Again, you have a tool that will reduce pain faster, stimulate a healing response, and improve your chiropractic outcomes in just about any case that you're treating. What current patients would be ideal candidates for laser therapy? I used to just target certain patients, but basically in my report of findings now, if I have a musculoskeletal patient in front of me and they're having pain and inflammation, the laser is recommended as part of their treatment plan, as long as I understand the condition. And how could automatic treatments improve the practice productivity? It's, again, a very clear cut. I worked with the Mixed 5, which was a good tool. It was effective in therapy, but the robotic nature, the ability to set your treatment protocols, have a much more specific dosage to the patient, and be able to have the ability to move in and out of the room while the patient's being treated will greatly improve the productivity of your practice. So thank you for watching. I hope this was helpful in helping you make a decision to incorporate the MLS laser therapy into your practice.
Thank you, Dr. Brennan and Patrick, for today's presentation. And thank you to everyone watching. If you have any questions about this presentation, you can email Dr. Brennan and Patrick at info@drtimbrennan.com. If you would like to learn more about MLS laser therapy from Cutting Edge Laser Technologies, please visit celasers.com/CE webinar or email us at cmodzel@celasers.com. Thank you.